All right, welcome back, everyone. My name is Amalia Almada, and I'm the Senior Program Manager of the Planetary Health Alliance. So we are diving into the final few hours of the 2019 Planetary Health Annual Meeting. We have a really packed and exciting agenda this afternoon. We'll have this brief session giving highlights from the 8 concurrent breakout sessions we had. We had so many interesting panels, it was really hard to choose which ones to go to. I'm sure you all felt that. So we will have audio of all those breakout sessions online after the conference, so feel free to listen to those. But in the meantime, we are going to have report backs on those concurrent sessions. We'll also have 2 keynotes, 2 plenary panels, and another round of lightning talks this afternoon. So I hope you have all had your coffee. And I'm really excited to dive right in right now. So we'll have a brief 2 to 5 bullet points of key takeaways from each of the breakout sessions. And we also will have 2 to 3 minutes for each person, so a lightning talk in effect. So we'll start with Bennett Kissel from UC San Francisco.
I'm a third-year medical student just up in the city and interested in psychiatry, mental health, climate change. So our presentation was 6 of us, 4 from UCSF Medical School and 2 from here at Stanford. And we created a Planetary Health Justice Report Card, which is basically the concept of grading the grader. So taking it to as students, taking it to our institutions and saying, here's how you're doing in our eyes in integrating planetary health content into the student experience. And so those discrete metrics that we used, one was advocacy and community engagement. The other was student support for initiatives. Another was research and curriculum. And we created this report card and then presented it to the group and then solicited feedback and tried to break out and do more development around how it could be applied to something other than just medical school. But it was difficult to bridge that gap. So our 2 largest takeaways were, one, that we need help. We need help as students getting feedback from all you guys and anyone that thinks that this is interesting or that their opinion, they could add some value to it. And second is that we actually can, as students, we've been able to make a big impact in convincing our university to change. A lot of people were there that were that have worked hard for a long time, and we're starting to see movement. So, and the student voice going to the deans and to the academic departments asking for more integration of the multidisciplinary education has been it's been very valuable. I know that's vague, but medical school is my expectation coming in, and all of ours was that it was going to be a place that addressed climate change and environmental determinants of health, and it has almost entirely wholly not done that. Which is really surprising considering we're going to be clinicians in a vastly different future than we're in now. So we find it's important for us to be trained in these realms, and so that's why we're trying to push our university. If you're interested in helping us make that push, please find me. Then I can give you our report card and you can say what your thoughts are. Thank you.
Thank you, Bennett.
Hi, I'm Lisa Mandel with the Natural Capital Project here at Stanford, and I'm giving the report back from this session on scaling freshwater solutions. I've got 4 takeaways for you guys. First is that the global freshwater crisis is serious. I'm sure that comes as no surprise, but there are challenges everywhere from meeting basic human needs to the environmental and ecosystem level impacts, food production, water access and conflict, and of course in the context of climate change. So this can be kind of dizzying to think about the challenge, but the second takeaway is that there are innovative solutions that are being implemented around the world, and we heard a number of really exciting approaches. Several tech and engineering-based approaches, including water reclamation and water reuse, stormwater capture, water banking. We heard about soft path solutions, more on the governance and economics and institution side to reduce demand through improved efficiency, improved management, including real cost pricing, and decoupling population and economic growth from water withdrawals. We also heard about nature-based solutions, so thinking at a watershed scale, and that these management of watersheds and conservation of watersheds can deliver real benefits in terms of regulation of flows, reducing sediment, and reducing risk from extreme events. And water utilities in Latin America are already investing in some cities a portion of their ratepayer fees in watershed conservation and seeing real returns on those investments in terms of benefits to the water users and the water utility, and obviously in terms of the environment as well. The third takeaway is that these approaches are interconnected and decision-making needs to be more integrated. But these approaches can be used effectively across scales. And another common theme was that discussion of the co-benefits of these approaches is really key to bringing a diverse group, a coalition together to turn the ideas into action. And I'd say our fourth takeaway is that water is connected to so much of what we care about that the group really hoped that fresh water could be a more central part of the discussion at the Planetary Health Alliance meeting next year in Sao Paulo. Thank you.
Great. Perfect. Is that on? So I'm Giulio De Leo. I co-organize the breakout session on disease ecology with Sana Sokolov, who's here in the audience. You probably have heard about disease ecology. It's a part of a discipline of the broader area of ecology that is particularly focused on host-parasite interaction, which is their context and in their environment and evolutions. And this has been a rapidly growing discipline with, especially in the past 20 years, that has the merit of having brought attentions on the environmental drivers of disease, and also in some cases an understanding how can leverage on this knowledge to have a better control on disease. Our panel had 4 fantastic speakers. We had Sarah Zodi from Auburn University in Alabama, who talked about sustainable uses of forest in Madagascar and a reforestation project that can come along also with sustainable use and development of highly valued crops that basically engage the local population in this reforestation project. Amish McCallum from Griffith University in Australia talked about Hendra virus spillover from bats, help us to understand what drivers they identified for this process coming along more and more often, and how these drivers are mostly related to basically physiological stress due to poor nutrition for bats and the impact that these have on the immune response. And so they have identified a number of levers that can help to reduce basically these processes and remove the bats from where horses and people are. Canary Webb talk about, from Health in Harmony, talk about an amazing project that she has been conducting in Bora in the last 10 years, and it is a project that sees things from another point of view. So we all have recognized how basically ecosystem preservation of ecosystem integrity allow to basically deliver ecosystem services in terms of better human health. But Canary Webb have been seeing things from the other point of view, so how by delivering basically health care to match the basic needs of local population, it is possible to actually reduce behavior that is unsustainable and so reduce the rate of deforestation of the forest. Lastly, Skylar Hopkins for Virginia Tech has been presenting the result of a massive literature analysis in which have been looking basically around thousands of cases of allegedly win-win solutions, boiling down actually to a very small handful of documented cases where the hard data show that there has been an improvement for both health and the environment. But her work also allowed to identify a good number of cases cases that are promising because while the data is not there yet, there is the opportunity actually to fill in those gaps. We have a couple of takeaways from our section. One, within the context of planetary health, we all see, I think, the need of a paradigm shift from just studying the driver, the environmental driver of disease, which is a super challenging task on its own, but by focusing more attention on how to use this knowledge to deliver actionable solutions. And likewise, as a second takeaway, rather than focusing on disease per se, putting more emphasis on the levers for health and for conservation, and basically pushing us to try to acknowledge this very coupled intrinsic nature between the ecological system and the human system. So I'll stop here.
Great, hello. I'm Joy Chimay-Guillemot and have led the session on cascading and compounding climate risks. And so our session had 4 panelists: Chris Ebi from the University of Washington, Neil Adger from the University of Exeter, Claire Heaviside from Oxford, and myself from the WHO-WMO Joint Office in Geneva. And our sessions looked at how climate change is driving the increasing frequency and intensity of extreme weather and climate events, and that, frankly, our current frameworks for understanding and preparing for these coupled and simultaneous extremes are really insufficient for multi-hazard risk management, because there's exceptionally complex decision-making and adaptation planning that needs to happen, taking into consideration a lot of interactions, both at the hazard level, but also at the social vulnerability level. And so we looked at some examples of coupled heat wave and cyclone events, as well as how heat waves and drought conditions may trigger food crises in another part of the world. We also looked at how urban conditions amplify specific risks due to multiple and interacting factors of dense populations, air quality, governance issues, and the built environment. We discussed how environmental consequences and environmental degradation is often compounded through the social amplification of risk. And we talked a lot about the issue of migration as an adaptation response, and saw some evidence from the Asian megadeltas that rational decisions to move away from risk often result in moving into harm's way. And that a reoccurring theme throughout the whole conversation is system teleconnections between these hazards as well as social and built environment that are helping to construct the vulnerability to these complex events. A big theme that came out is that mental health impacts are one of those delayed teleconnections often, that people are traumatized by extreme weather events, but sometimes we don't see that trauma until much later. But there is strong evidence around suicide rates, PTSD, depression from losing livelihoods, losing family members, that really have important ramifications for the social resilience that's actually required to prepare for and bring communities together to be able to confront these types of complex emergencies that they're facing. And in moving forward, the issue that we need to be unpacking a lot of these social vulnerability issues in a much more comprehensive way. Really diving into the demographics, driving adaptation opportunities and barriers to adaptation, as well as how to build social cohesion that will be required to confront these issues. And then, of course, to continue working across disciplines to understand these issues, as well as manage risks in the community and governance. Thank you.
Hello, my name is Nagla El-Abadi. I'm a postdoc at Tufts School of Nutrition, and I'm also one of the organizers of the PHA Education Working Group for K-12 education. So our breakout session was on engaging the world's youth in climate and environmental action. We had a wonderful panel of 5 speakers with Dr. John Balbus from the NIH, Daryl Steele from the Carmel School District, Daniel Platt from the Sunrise Movement, Ana Gonzalez Guerrero from the Youth Climate Lab, and Melvin Otieno from the University of Eldoret in Kenya. We were fortunate to have these voices to speak from the education level as well as give us a youth perspective. And when you consider that almost, I believe, 4.5 billion people, or more than half of the global population, are considered youth, that is the largest youth generation in history. So how do we engage them in climate action? So some of the thoughts were meeting people where they're at, not just to continue the echo chambers, but to get to the community centers, to have events covered, branding, identification, and since they're students, bring free food. That's important. We did also speak about the mental health aspect and the need for mental resiliency. I learned terms such as climate grief and eco-anxiety as real terms that are coming up. And so the idea was that for the adults, messages that relate the urgency of the situation, certainly, and for the youth, having an optimistic outlook, acknowledging their agency, giving them empowerment to take part and be part of the solutions. Thirdly, to support educational efforts, particularly in the international community, we can develop short course certificates, training opportunities, research engagement, conference participation, which the PHA has already incorporated successfully. And so there are many ways to engage youth, and we can certainly collaborate and engage with the educational experts, the topic experts, and then also bring in young people and students into these efforts so that we're training them with the skills they need while also inspiring them with the narratives that they can identify with and feel like they are empowered to reach the solutions to planetary health challenges of the world that they are inheriting. Thank you.
Kia ora koutou. My name is Margot Parks. I'm originally from Ngāi Tahu Territory, New Zealand, and I live in northern British Columbia now in Breakouts Territory. Don't you wish you were in 5 places at once in those breakout sessions? What an amazing summary. I wish I was in all of your sessions, actually. But in some ways, our session, which was focused on linking communities, justice, and living systems, connections for a healthy and thriving future, was almost imagining all of those connections, but grounding them in 5 amazing stories and places and communities where our panelists were speaking from. So our panelists included Emanuela Shinta, who some of you heard from yesterday, hearing from the Dayak tribe in Kalimantan and the ways in which those communities are responding to justice and living systems. We had Rachel Devi from Fiji, who was speaking about the WISH project and the connections of watersheds and as systems interventions for health. We had Sandy Naranjo, who was talking again about mothers out front, but some of the ways in which those mothers are connecting across justice and living systems concerned, and Moses Chimburi from Durban in South Africa. So we had a fantastic planetary group. We really enjoyed, actually in our imaginations, moving across the planet, sort of scaling up to these planetary connections and then down into these communities where these real stories are unfolding in ways that are impacting and motivating both inspiring research but really interesting actions. So one of the obvious things is that whether it's climate change or in many of these communities, they're facing a combination of impacts of mining or agriculture or deforestation, and then climate change is yet another overlay on making all those things worse. But even without climate change, there's incredibly important connections with these living systems and the justice issues that it's creating. In terms of key messages, there was the idea of understanding living systems in a way that thinks of us in terms of intergenerational equity, thinking forward on the living systems that are going to be the foundation for our ability to survive going forward, and that's got not only an intergenerational aspect but also an interspecies aspect, and that there are in all of these ecosystems that we were talking about, there are other species that are also bearing the brunt, whether that's the forests or the animals and the other species. The idea, of course, that community engagement in its fulsome said these ideas are not new. And so the planetary health community, when it's thinking planetarily but also needing to come down to the local level, there are not only the strong messages from Indigenous communities about how to begin, in particular how to begin your work. not figuring out halfway through, but the approach and the respect and the approach that you're bringing, where communities are not objects, but they're part of the conversation from the beginning, and that there are deep traditions, scholarly traditions, that can help us inform this kind of work. As Planetary Health needs to engage in those, there's lots of things that, that can be learned from. And then there is the important idea that the boundary crossing does actually make people, it poses challenges for people, and so spending the time early on and making connections that we really spoke about the fact that if you're just doing health and justice and you're not focusing on the living systems and the ecosystems, you can miss the point. But if you're just focusing on the ecosystems and not connecting with those equity issues, you can also miss the point as well. So inspiring stories, and thanks for all the other work that was done as well.
So fortunately and unfortunately, there's been a packed house at the Indigenous speakers' lunch. So the report back from the Leadership, Influence, and Power session is not here. Chris, could I put you on the spot, or I'm happy to give a brief recap? Okay. All right, so on the fly here. So this session was called Leadership, Influence, and Power, Working with Policymakers to Advance Planetary Health. We had a stellar panel with a bunch of representatives from across the globe, having served in various kind of political office or government type roles. So this was led by Dr. Courtney Howard, who's president of the Canadian Association of Physicians for the Environment. Our panelists include Christine Lowe, who's currently at the Hong Kong University of Science and Technology. She spoke to a lot of her experience as Undersecretary of the Environment in Hong Kong, using air. Oh, Courtney's here, but I'll just wrap up quickly. Basically, she was talking about air pollution as kind of a central issue that was used, really united across China and Hong Kong at a time when that was not easy to do. The importance of monitoring science to really be the language and culture that brought those different cultures together. This was a theme that kind of resounded across the panelists, the power of science and evidence and making that broadly accessible, easily accessible to really make change in political arenas. Tasso Azevedo from MAP Biomass now spoke to his role on the Forest Commission in Brazil at a time where tremendous progress was made in reducing deforestation, spoke to the importance of also really understanding the person you're talking to, what their motivations are, how you can pivot your message to connect on a personal level and leverage that human experience that sometimes as scientists we forget to bring to these conversations. Daniel Kamen from UC Berkeley spoke to his role as special envoy to the president. He was in that role at the end of the Obama administration in the US and kind of spoke to his story of speaking truth to power at a time when the administration in the US changed. Some of his role kind of within that arena, something that's stuck with me from that was how a lot of career scientists, people within the administration now are really left with a heavy burden to continue on the work while folks like Daniel made the choice to leave, but how important that is to continue to support those career scientists that are still within those settings with less power to really speak truth to power. Dr. Elizabeth Baca was also with us. She's a physician, social entrepreneur, and policymaker. Spoke to kind of the California context, having worked with the mayor of San Francisco and some amazing implementation of health policies within that setting. And Chris Field from Stanford Woods Institute also spoke about the importance of leadership, allowing more opportunities for leadership training, especially within the academic setting, that's kind of a skill set that's often targeted within military, that being a really important role and dimension of training that is not often so supported, but new programs and old programs like Leopold Fellows and others being really a pathway to instill that skill set. So that was it. Much better and more eloquently said within the session itself. So please listen to those audio versions that will be available online soon after the conference. But I'd like to thank our panelists. Thank you so much for your report backs and all of that rich content.